Hi, welcome to our telehealth medicine information video. I'm Garvin, and this video is on Microgynon 30 ED. So what is Microgynon 30? Microgynon 30 is a combined contraceptive pill, usually just called a pill. It contains two hormones, an estrogen and a progestogen. Most women take Microgynon to prevent an unwanted pregnancy, but it's also prescribed for women who have problems with particularly heavy, painful or irregular periods. Taking it usually results in lighter, less painful and more regular menstrual bleeding. Microgynon 30 is the same as other combined pills containing ethinylestradiol 30 microgram and levonorgestrel 150 microgram, and some of those brands include Overnet. So how does Microgynon 30 work? Each Microgynon 30 tablet contains two active ingredients, ethinylestradiol 30 microgram and levonorgestrel 150 microgram. These are synthetic versions of the naturally occurring female sex hormones, estrogen and progesterone. Combined pills like Microgynon override your natural menstrual cycle and work mainly by stopping your ovaries from releasing an egg each month. They also increase the thickness of the natural mucus at the neck of the womb, making it more difficult for sperm to cross into the womb, as well as thinning the womb lining, which makes it more difficult for any successfully fertilized eggs to implant there. You take one pill every day for 3 weeks and then have a week break before starting the next pack. During your pill-free week, the level of hormones in your blood fall and you usually get a withdrawal bleed. That's like your period. So key facts about Microgynon 30. Microgynon 30 is most often prescribed for young women who don't have any major health issues. It's not suitable for women who have had an increased risk of getting a blood clot, including women over 35 who smoke. Microgynon 30 won't protect you against sexually transmitted infections. You'll still need to use condoms for that. The most common side effects of Microgynon include headache, feeling sick, breast tenderness and mood changes. Breakthrough bleeding, spotting and missed periods can be common in the first few months. So see your doctor if these symptoms persist. If you don't have a period for 2 consecutive months, do a pregnancy test before starting the next month's packet of pills. Blood clots are a rare but serious side effect of the pill. Who shouldn't take Microgynon 30? Microgynon is not suitable for everyone. You shouldn't take it if you are over 35 and you smoke, or you stopped smoking less than a year ago, or you're very overweight, you have a BMI more than 35, if you've ever had a blood clot in your leg or lung, if you've ever had a heart attack, angina, stroke or mini stroke. Can you take Microgynon if you're breastfeeding? The combined pill is not the preferred method of contraception for women who are breastfeeding, because the estrogen in it can reduce the amount of breast milk you produce. If you decide you want to take it, you shouldn't start it until at least 6 weeks after birth, when breastfeeding is fully established. So how do you take Microgynon 30? Microgynon 30 tablets come in a calendar pack marked with days of the week. You take one pill at the same time every day for 21 days and then have a 7-day break. During your 7-day break, you usually get a withdrawal bleed that is similar to your normal period. Start your next pack after the 7 pill-free days are up, even if you're still bleeding. If you want to delay your period, you can take 2 packets back to back without a break. Have your 7-day break at the end of the 2 packs and you should get your period then. You'll still be protected against pregnancy in the pill-free week, provided you took all the pills correctly. You start the next packet on time and nothing else happened, that could make the pill less effective. So when can I start taking Microgynon 30? Check with your doctor, because this depends on personal circumstances, such as if you're changing from another form of contraception, or if you're starting the pill after having a baby, or following a miscarriage or abortion. Your doctor will also advise on how soon you'll be protected against pregnancy. For some women, this will be as soon as they start taking Microgynon, but most women need to use an extra method of contraception, such as condoms, until they've taken Microgynon for 7 days. So what should you do if you miss a pill? So if you forget to take your pill at the usual time, take it as soon as you remember. A missed pill is one that is 24 hours or more late. If you miss a pill, you follow these instructions. So for one missed pill, if you forget to take one tablet or start your new pack 1 day late, take the pill you missed as soon as possible, even if it means taking 2 pills at the same time. Then continue taking the rest of the pack as normal. You'll still be protected against pregnancy, and you don't need to use extra contraception. 2 or more pills missed. So if you forget to take 2 or more pills or start your new pack 2 or more days late, you won't be protected. Take the last pill you missed as soon as possible, even if this means taking 2 pills at the same time. Leave out the other missed ones, then continue to take your pills, one every day, as normal. You should either not have sex or use a barrier method of contraception for the next 7 days. If the pills you missed were in the last week of your pack, finish the pack as usual, but then start a new pack straight away without a break. So this means skipping your pill-free week. If you had unprotected sex in the 7 days before you missed pills, you may need to take the morning after pill. Get advice from your doctor or pharmacist or local family planning clinic. If you struggle to remember to start your next pack on time, you might find an everyday pill like Microgynon 30 ED is better for you. So this is one pill every day. So what if you have vomiting or diarrhea? If you vomit within 2 hours of taking a pill, you should take another pill as soon as you feel well enough. Then take your next pill at your usual time. You should still be protected against pregnancy. If you keep being sick, or if you have severe diarrhea for more than 24 hours, this can make your pill less effective. Keep taking your pill at a normal time, but treat each day that you are sick or have severe diarrhea as if you had forgotten to take a pill and follow the instructions I mentioned earlier. Can you take other medicines with Microgynon 30? If you regularly take any of the medicines that I'm going to mention below, then Microgynon probably won't work for you. So you need to use a different form of contraception. Certain anti-epileptic medicines such as carbamazepine, oxcarbazepine, phenobarbital, and phenytoin or topiramate. Some medicines for HIV such as cobicistat and ritonavir, the antifungal griselulvin, modafinil for narcolepsy, the antibiotics rifabutin or rifampicin for tuberculosis, and St. John's wort, the herbal product. If you're prescribed a short course up to 2 months of any of these medicines while you're taking Microgynon, this can also make it less effective, and your doctor will usually recommend that you temporarily use a different form of contraception. If you want to keep taking Microgynon, talk to your doctor about what to do. You'll also need to use an extra method of contraception for as long as you take the extra medicine and for at least 4 weeks after stopping it. Microgynon is not usually recommended if you're taking the anti-epileptic medicine Lamotrigine or Lamictal, the brand. While you're taking Microgynon, it's a good idea to check with your doctor before you take any other new medicines. So antibiotics other than rifampicin or rifabutin won't make Microgynon less effective unless they give you diarrhea or make you sick. So what are the side effects of Microgynon 30? So the following are some of the side effects that may be associated with Microgynon. And just because a side effect is mentioned, it doesn't mean that everyone taking the contraceptive pill will experience that or any side effect. So common side effects include feeling sick, abdominal pain, headache, breast pain or tenderness, slight bleeding or spotting between periods in the first few months, lighter periods or sometimes stopping of periods, mood changes, however there's no evidence that the pill causes depression, some fluid retention, however there's no evidence the pill causes weight gain. So for more on risks and side effects, you need to read the patient information leaflet or talk to your doctor or pharmacist. Increased risk of getting a blood clot, which could cause a deep vein thrombosis or clot in the leg, or pulmonary embolism, which is a clot in the lung. But the risk is small, so each year between 5 and 7 women out of 10,000 taking Microgynon will get this type of blood clot, compared with 2 out of every 10,000 not taking it, and 29 out of every 10,000 who are pregnant. So what if you get pregnant while taking Microgynon 30? It is extremely unlikely that you get pregnant if you take Microgynon 30 correctly every day. But if this does happen, there's no evidence that the pills you have taken will harm the baby. So that brings this video to an end. If you have any questions, you can leave them in the comments below, or contact us through our website, mytelehealth.info, or call to Lynch's Pharmacy, Douglas, Cork, or ring 436-6923 to find out more. Thank you for watching. Stay healthy and stay informed.